Hello, everybody. My name is Dr. Rumbi, and I'm a naturopathic physician in Scottsdale, Arizona. And I specialize in chronic conditions as well as integrative oncology. And this is my very first live. Thank you all for joining. I'm super excited. And the whole point of today's live was to answer all your questions. A lot of the time, what we find, especially in the medical field, is questions that patients typically have don't always get the answers that they need, or sometimes patients may feel like they're not being heard because it's a system that's set up to basically it's you've had short appointments, and within that short amount of time you have maybe 8 minutes to 10 minutes to tell a doctor your story and hope that they understand what you've been struggling with, and then from that they can then prescribe something to help with that. And more times than not, what I've found in practice and in life is 10 minutes is not enough to time to tell your story. It's not enough time to explain what it feels like to be in your body, especially when it's related to health issues. So whole point of today's life was to kind of give people that space where I can hopefully answer some questions that you might have. And with that, we're talking about things that can range from just understanding your symptoms, which can be maybe fatigue that just doesn't seem to go away no matter what you try to do, to maybe, for example, lingering cough, depression, anxiety, all those things. Because if there's one thing that I've learned and one thing that I'll tell you, it's your body always speaks to you. And when we talk about the body speaking to us, especially in this context, we are actually talking about symptoms. Whenever you experience anything, like I said, we gave the example of fatigue, that's the body's way of trying to tell you something. It does not necessarily mean that it's a very bad thing, but nonetheless, it's important and prudent that we listen to what the body's trying to tell us. So, as I mentioned before, when I kind of started this, I deal with a lot of integrative oncology. And what that means is you're looking at cancer from a lens, from a deeper lens. You're not just looking at the tumor itself, you're now looking at the microenvironment. You're asking what I would call the most important question, which is why now? And you're also asking not just why now, what caused it to happen? When we look at cancer, and again, I don't know how much you may know, but I will tell you one thing, that our body is constantly dealing with that on a daily basis. Your immune system is constantly working and finding ways to mitigate that. But when you get an official diagnosis, more times than not, that happens because something may have bypassed our immune system. So the key would then be to try to understand what happened in your body at this point that would allow it to come through. So in my world, or in the world of providers similar to me, we are looking at things like terrain. And when we talk about your terrain, we're talking just basically in simple terms, just how your body looks, like your systems in your body, from mitochondria, which is what produces energy, to your metabolic processes, how you're able to break down food, how you get energy, all these different systems, right? They all play a role in making sure that your body's functioning well. But if one of those systems, for example, it may be the detox pathway, if one of those systems gets broken down, that's where chronic disease starts trickling in. So, just to give a better explanation of what indeed is, for example, integrative oncology, or what is it that I actually do, it's looking at those pieces. It's trying to understand how is your metabolism, how's your energy system, is your mitochondria working optimally to the point where you're able to produce the energy that you need, not only for daily functions, but enough to help your body detox when it needs to, enough to help your liver break down what it needs to, your kidneys, and so forth. Because if that system is lagging, again, like I said, it then affects the other systems. Not only is it important to then understand what's happening in those systems, it's also then important to understand what went wrong, right? One thing that a lot of us may not be aware of is our bodies are so resilient and they have this inherent ability to heal. So, what that looks like is if something is wrong, your body finds ways to mitigate that, to curb that. It tries to find a way to bring back balance. So, what that looks like, for example, could be if you're experiencing more than usual fatigue, you'll find that perhaps your liver starts breaking down glucose more, or perhaps some systems will then transfer that energy to somewhere else. And then when that happens, and the whole point of doing that is to help to give you more energy, right? So, this is the body's way of trying to fix that. So, this can happen for a long period of time. And this enters what I like to call the gray zone, and that's usually a point in time where you're not so sick that it's very obvious, but at the same time you definitely know that something is going on, something is wrong. And at that point within that gray zone, it's very difficult to get a diagnosis because more times than not your labs are normal at that point. So labs are looking good, but you know that you're not feeling quite yourself. So that is the time usually when I find that the body is kind of doing a push and pull, where the body is trying to compensate for whatever is going on. And that is where it is so important to dig deeper, to look deeper, to run more extensive labs. It might be to run, now when I say extensive labs, I'm talking about looking beyond basic labs like CBC, CMP. That's when it's important to look at, for example, your stool. What does that look like? What's your gut functioning like? We have to look at things like your mitochondria because they themselves can tell a wider story or bigger story that you would get from basic labs. And it is so important to look at systems in that case because when you're able to really get that lens and look at it like that, you're able not only to treat certain conditions, but you're also able to catch something before it worsens. So this is why it's so key. And when we're looking at cancer, it enables us to understand what's feeding the cancer. Because with cancer, or even with chronic disease, it's not just about the disease itself. It's about what keeps that disease going. Why aren't we able to just stop it? What made that disease show up in the first place? And when you're able to dig deep, it allows you to look at all those things. So I guess what I'm trying to say, the long and short of this is the whole point of what I do is to really look at it with a fine lens, is to really understand your body inside out, to understand, and in understanding your body inside out, we're not just talking about, my, I know I mentioned mitochondria, functional liver. We're also talking about what are you eating? How is what you're eating affecting you? Where do you live? What type of household products do you use? All those things come into play. Another very important thing that comes into play, for example, is your emotional state. Are you constantly under high stress? Are you in a high stress job, high stress environment? And if that's the case, what are you doing to mitigate that high stress? Oh, I just got a question while we're talking love that says, why does where I live matter? That's a very good question, and let's dive into it. Where you're living actually matters by, for example, let's look at water. You'll find that, let's use the Mississippi River as an example. Mississippi River, you'll find that they dump a lot of stuff in there, I sad to say. So because of that, more times than not in clinic, I see a lot of patients that will come in with high lead levels, not just lead, we're talking phosphates, triclosans, a lot of these chemicals that are found in that water source, right? So that's why it's really important to look at your water, because if it's something that's coming from your water that can cause sickness, then you're able to find a filter to help with that. And I live in Arizona where our air is not the best. So because we don't have the best air, it's important that I have a filter in my office, in my home, to help curb any effects or anything that could possibly happen due to that air. And you can ask anyone in Arizona and they'll tell you, you could be driving on the highway and they'll say, today the air is not so great. It's not a good time for kids or older people, people who have health conditions that might, get affected by this air to come outside the house. So that's another thing. We could talk about temperature, heat, dry heat, or even cold temperatures. All these things do affect your health. The type, and when we talk about food, we're talking about, is it organic? What type of pesticides are in it? And this is so important, especially when we're looking at cancer, and I'll explain why. You could have different types of cancer, like even estrogen driven cancer. So if your cancer is estrogen driven, there are different things in your environment that can actually drive those or increase the kind of make that cancer worse because they're actually adding that estrogen in the first place. So that's where we're looking at BPA plastics, which are found in most things. If you store your food in plastic containers, canned goods also have BPA in them, or it could be your skin products. if they're not really organic, that too can affect those type of markers. So this is just a small example. Another example is nuts. You'll find that a lot of nuts, especially the ones that are not organic, contain a lot of mold. And mold can actually drive a lot of chronic conditions. So this is what I mean when I say it's important to look at everything. And in integrative care, like what I do, we leave no stone unturned. And that's something that I have found to make, and sometimes it can be the difference between life and death. It's something that is so important to look at. And it's also the cornerstone of healthcare. It's not just about taking a certain pill. Yes, taking a certain pill could possibly help mitigate or reduce those symptoms, but it still does not address the root cause. And when it comes to disease, it is so important to figure out what that root cause is. That way, you can stop that thing from coming back again and again and again. And you can also help to strengthen your system so that if it does come, you're resilient enough to face or to curb whatever might be trying to affect your health. All right. So I think I don't see any other questions, but I hope you learned a lot in what. Oh, there's another question. Oh, all right. I'm really glad I was able to help you understand. So, as I'm saying, this is going to be the first in many podcasts that I'm going to start doing, and my heart in doing all of this is to really educate people because it's so important that you take ownership of your own health. When you take ownership of your own health, it changes everything because now it's almost like you're your own physician, and when you do that, and if you can find a doctor who's able to partner with you in that, I mean, I can tell you countless positive results that I've seen just from doing that. So if you remember anything from this short talk, it's take ownership of your health, start looking at your environment, start looking at what you let in, not only physically but also emotionally, and start making strides to understand your health better, to understand what's important, what works for you, what are your food, your environment, even things like supplements, because in some cases you may not be able to source the things that you need for optimal health, and it may have to rely on things like supplements. So I encourage everyone to make it their mission to dig deep, to learn more, to stay hungry for knowledge, and to just strive to be the best version of yourself you can be.